as well as Maura Calsyn, who is the head of health policy at the Center for American Progress. So we're really excited to have everybody involved. And why don't we turn it over to you, Rick, and you can kind of give a layout here, and we'll get things going.
Okay, thanks a lot, Adam. We've had over, I think, 160 some folks that RSVP'd tonight, so they're still coming to the call. But we'll move ahead because I know Tom's got a short window this evening. I do want to say thanks for jumping on this call tonight. I know everybody's busy, but this is obviously an extremely important project we're trying to get off the ground. And it's great to have an overwhelming response after a very overwhelming, exhausting election cycle. It's obvious that the time has come to do Medicaid expansion in South Dakota. We started this project over 2 years ago, and reaching out to various stakeholders, private citizens, organizations. I really think South Dakota's come a long way. It's unfortunate we didn't do this 10 years ago when the ACA was passed, because I know we left a lot of money on the table, and I'm sure a lot of lives have been lost and damaged, if you will. But we've been steadily moving the ball forward over the last couple of years, laying the groundwork for which, frankly, it's brought us to this evening tonight. I'm not going to bore you with all the details of what it takes to get to a kickoff like we're launching tonight. I'll just only tell you that we have actually been cleared by the Secretary of State's office to circulate petitions a few days ago. So we're ready to hit the streets, and that's in large part what tonight's all about. We have both a statutory measure and a constitutional amendment. We're going to need to collect about 25,000 what they call raw signatures for the statutory measure. To qualify out of those raw signatures, about 16,961 valid signatures. And then on the constitutional amendment side, our target is to collect about 50,000 signatures raw to come up with a valid number of 35,617 signatures. We're doing both because, as you all know, we've learned some lessons from years past, from the passage of the minimum wage, which was done and yet amended by the South Dakota legislature, then was referred and then ultimately passed in its true form. But also the Anti-Corruption Act, IM 22, which was repealed without an opportunity to refer to the voters. The legislature seems sometimes to ignore the will of the voters and our state motto of under God, the people rule. So we're taking this very seriously. And I see that Senator Daschle has joined us. Tom doesn't need any introduction. We've been spending a lot of time on Zoom calls the last several months, but really an honor and a treat to have him share a little bit of his night tonight. He doesn't have a lot of time, but he is one of the leading experts in the country when it comes to healthcare and healthcare reform. I remember working with him on the effort in '92 with then First Lady Hillary Clinton, and obviously he's got the obviously the credentials, and I'm just going to turn it over. Tom, it's all yours.
Well, Rick, thank you very much for that kind introduction, and thank you and Adam for organizing Dakotans for Health. I think this is a very, very important beginning. A special thanks as well to my dear friend Doug Somke and the South Dakota Farmers Union for partnering with Dakotans for Health. I think their involvement can really make a huge difference, and I'm just delighted to know that that he is part of this very important effort. And let me just say how grateful I am to each of those of you who are joining us tonight for your interest and support in the effort. I think I've seen the list of those who have signed up to participate tonight, and it's clear it's a very diverse group. But I think there's one thing that unites us, and that is a recognition that we're facing just an extraordinary health crisis in the United States and in South Dakota. It's just tragic that 250,000 plus people now have died due to coronavirus. You know, just to put that in perspective, not that I need to, but that's more than all the wars since World War II put together. We've seen now over 12 million cases, and South Dakota, sadly, is one of the worst of any state in the country today. So it is tragic. And what's really tragic is that it didn't have to be this bad. I work a lot with a number of foreign countries, and one of those countries is Japan. Some of you know your geography and you know the demographics of Japan. They have about 130 million people, but they've only had 1,900 deaths. I think that's just remarkable. Why? Well, because they wear masks, because they socially distance, but also because every single person in Japan has health insurance, has access to care. Besides an unwillingness on the part of many to wear masks and socially distance, I have talked to countless, and I mean countless, health experts who tell us that the biggest reason for the disparity between countries like Japan and the United States is that here in this country, about 80 million people have either little or no health insurance at all. And that's especially true as a result of the state of our economy now with the coronavirus. I'm struck by a number of polls that I've read in recent months that report about 40% of working Americans tonight admit they couldn't pay an unexpected $400 medical bill. Just imagine that. The problems around cost and access and the quality of our health care grows exponentially with every passing year. No one on this call has to be reminded that it is the single biggest cause of bankruptcy in our country today. And that's especially true in our state of South Dakota. So I have to say, it's not hyperbole at all to assert that this issue tonight, the one that has brought us together, is a matter of life and death for countless South Dakotans and Americans all over this country tonight. It may be one of the most important health issues in South Dakota of our lifetime. I believe it's a very conservative estimate, but I'm told that it would affect the lives of about 42,000 South Dakotans. But I think that's very conservative because it's also a rural hospital issue. It could mean the difference for countless rural hospitals and whether they stay open or whether they close. It's an exponentially important farm issue. Doug can lay it out a lot better than I ever could, but this is a real factor on whether many South Dakota farm families survive the next 10 or 20 years. It's an economic issue. We have a growing economic disparity in South Dakota and in our country, and I think we should admit it and recognize it. It's getting worse by the year, and Medicaid expansion could be the start of an effort to begin closing the gap. But expansion is also an economic boom to South Dakota. It means at least $300 million in federal revenues alone in just the first year. It means more jobs. It means more business. It means more income for a lot of South Dakota families. 38 states have now adopted Medicaid expansion because they all have recognized these facts and many more. It's time South Dakota does too. We need to build as broad a coalition as possible to be successful. And that's why your participation tonight is so important. It'll be difficult. Rick just laid out one of the reasons why, just the number of signatures needed and how it has to be done. But difficulty is an excuse that history never accepts. So I wish you the very best of luck as you begin, and I hope we can stay in touch along the way. Rick, I'll turn it back to you.
Senator Daschle, say hi to Linda for us and have a great evening. Appreciate it. I want to introduce our next guest. Adam gave a brief introduction, but Maura Calsyn is on the conference, and she is with the Center for American Progress. She is the Managing Director of Health Policy at the Center, a nonpartisan progressive think tank, policy institute based in Washington, D.C. She helped lead CAP's health policy development and advocacy work these last several years, and has deep expertise in the Medicaid program and reform movement. So, Maura, it's all yours.
I'm just going to reiterate a lot of what Senator Daschle said. It's always been absolutely essential and necessary to expand Medicaid, but it is even more critical now. We are in the midst of an absolutely unprecedented, deadly pandemic, resulting economic crisis. South Dakota is one of the areas that has just been devastated, and it's just an absolute confluence of every single factor that makes Medicaid expansion really, really critical. As everybody knows, I mean, Medicaid expansion expands coverage for adults with incomes up to about $17,500 for a single person and about $36,000 for a family of four. Those are working poor individuals who desperately need healthcare coverage. I mean, overall, throughout the country, Medicaid expansion has been really historic. It's expanded coverage to 12 million people. South Dakota is sadly really an outlier right now. It's one of 12 states that has not expanded Medicaid. So it's just, I mean, as I said when I opened, it's never not been a good time to expand Medicaid, and it absolutely needs to happen now. I just wanted to mention a few things that I think are really important for people to keep in mind. I mean, research shows that Medicaid expansion really improves access to care, healthcare, but also there's real financial security for folks involved in this decision. I mean, access to care includes things like regular checkups and preventive healthcare, care for chronic conditions, a lot of the conditions that are really proven to be pre-existing conditions that have shown to be extraordinarily dangerous for people in the time of COVID, people with diabetes and high blood pressure, and those with respiratory illnesses. In addition, because you have better access to healthcare, you also then have better healthcare outcomes. There's been a number of different pieces of research that literally show that Medicaid expansion saves lives. Tens of thousands of lives across the country have been saved since states decided to start expanding Medicaid. And those who are covered under Medicaid, no surprise, report better healthcare. And other research, that's not self-reported shows better access to, diabetes prevention, hypertension control. It helps people diagnose early stage cancer in early stages. I mean, there's just really, the benefits keep flowing. I think the other thing that people forget is that in addition to these health-related outcomes, Medicaid expansion provides real financial security, which cannot be the importance of that can't really be overstated in the time of COVID. You are protecting people from unexpected medical expenses. People know that they could go to the hospital and get care. There's other ways that, that are less obvious, I think that really is important to mention on the financial security front. There's been a lot of studies of people in across the country who have really seen real changes, not just in their healthcare, but in their economic conditions, thanks to Medicaid expansion. So one that I think is just interesting and you wouldn't necessarily think about it is Michigan and Ohio people of gained coverage report that they're actually more able to go look for work now and get to work because they finally have the healthcare that allows them to actually go and seek jobs. And another study, I think that's again one step further than we're used to thinking about, states that have Medicaid expansion actually have lower eviction rates. So it's a total game changer for people, both health and financially. And two things have never been more important and have never been, have felt so under siege than they do right now in the time of COVID. So I just wanted to kind of make those points and really say I'm so thrilled to be involved in this effort. I know it's going to be a long, tough, but it has happened in states that are similarly have been similarly challenging. And, you know, anything I can do to help you all support the effort, I am more than happy to do so. And thank you so much for including me.
Thank you very much, Maura. You know, before I introduce Doug, who is the reason for the season and in Farmers Union for, you know, really stepping up and becoming our lead sponsor. I know that Maura and Margarida have young families, and time is always a precious commodity. Plus, I think they're an hour later than we are, at least that's what I was told. But Margarida, let me just give you just a little bit more background than what Adam offered at the beginning of this call. She is the founder and executive director of a group called Healthcare for America Now, HCAN. It's a national coalition that was formed to help pass the Affordable Care Act back in 2010. And she's worked with hundreds of organizations to implement, defend, and expand the law. In addition to working on the ACA, HCAN also works on protecting and expanding Medicaid and Medicare toward building an economy that works for everyone. Margarida has worked on healthcare nationally in many states, including most recently supporting Medicaid expansion campaigns in Virginia, North Carolina, Georgia, Missouri, and Nebraska. Margarida, nice to meet you on a Zoom. We had a great conversation the other night, so thank you for joining us. Okay, we got to get sound.
Here we go. Thanks to you. It's great to see you. And thanks for having me on the call. It is always so exciting to me to talk to advocates at this stage of a campaign to expand Medicaid. And having Maura on the call, my colleague that I work with on prescription drugs and healthcare, is just an added bonus. So makes it, even though it's a little bit late here, it's great to be on the phone with great colleagues. So I'm not going to take a lot of time. I just really want to echo a couple of the things that folks said. I can't agree more with Senator Daschle that this is a moment, it is more important than ever right now, as millions of people are facing increased risk, economic insecurity, even the threat of death. I mean, who would have thought that we would have gotten to this point, a major milestone, 250,000 casualties because of the COVID pandemic. So we know that exactly what experts like Maura and others are telling us, that this is a matter both of health, of life and death, of economic security, the future of the country, and the prospect of really a much brighter future if we can get people access to the affordable health care that we need. Medicaid is going to be, whether it's state expansion or it's federal work that we're doing on Medicaid, it is a key part of the plan to beat COVID and to get the country moving in the right direction. We're going to need healthcare no matter which way you slice or dice it. We know the program is incredibly popular. Well over 3/4 of the public supports Medicaid, and that has been true for a long time. And in state after state, Medicaid saves lives. There's a great stat that I like to use that actually, if we were to fully implement the Affordable Care Act and every state expanded Medicaid, Medicaid would save more lives annually than seatbelts save, right? So these are real numbers. Now, the good news about Medicaid, and this is why it's so exciting to be talking to South Dakotans tonight, is that you know, people have really, in state after state, put aside the politics, and especially today when we know COVID is not checking who you voted for in the election before it infects you. You're going to get infected no matter what you look like, where you live, or who you voted for. And time after time, we have seen voters put aside politics, take the question directly to the people, and pass the expansion measure via ballot measure. And so this is you know, really exciting prospect. Before coming to DC, I spent 6 years in Missouri, did a lot of work on Medicaid. You all probably know Missouri's the show me state. When we first talked about expanding Medicaid in Missouri, nobody believed it was possible. Can't do it, it's too conservative, people aren't going to go for it. And, you know, earlier this year, I think Missouri really showed them when they had a very successful ballot measure that included the hospital associations, the docs, you know, faith leaders from all around the state, small businesses, advocates, patients, was really a lot of people coming together. It sounds a lot like what you folks are contemplating in South Dakota. And through that effort, they were able to pass Missouri's Medicaid expansion law, which is going to provide coverage to an additional 230,000 people in that state that previously had no access to health care, even as this pandemic was raging for months. And so it's a very exciting development. I've been very encouraged watching Missouri, Oklahoma, Nebraska, Utah, Idaho, Montana. Many, many states have done this via ballot measure. And it would be fantastic to see South Dakota added to that list of states where people really came together and you know, took matters into their own hands when their politicians just weren't able to get past gridlock. So I just want to offer, as Maura did, Healthcare for America Now, we are here to support and help, and I'm happy to be part of the effort and looking forward to really being in touch with the team leading this effort and doing everything that we can to help.
Much, Margarita. Appreciate both you and Maura being here this evening. Feel free to jump off at any time. Stick around as long as you can. Don't want to cut into too much of your night, but thank you both so much for being part of our kickoff meeting and update tonight. Well, I really can't say enough good things about Doug Somke, and I like the bookend here between our two healthcare policy experts and our expert when it comes to what the hell's going on in rural South Dakota. And the South Dakota Farmers Union and the leadership of the Farmers Union are really just absolutely first class folks who care about their neighbors, their fellow farmers, and are really willing to take what they have and put it to work for the people of South Dakota. It's a great organization. I've worked with it for years. I've known most of the presidents, and this is a great one. I can just tell you that Doug has been very easy to work with. We started talking several months ago about this effort to expand or reform Medicaid, and his board is phenomenal. We had a meeting just a few weeks ago, and they, as Doug wrote me in a text, I happened to be on another call. I was curious as to how the meeting went after I got off the call, and he wrote me and he just simply said, "We're all in," and that's all I needed to hear. Doug, thank you so much. Turn the floor over to you. Tell us what this means to our rural communities and why the Farmers Union is so committed to making this thing happen.
Well, thank you, Rick and Adam. I mean, I really appreciate you guys getting this kicked off and started. Without your work, laying the groundwork for what we can do from this point forward, it would take us a lot longer. So thank you for getting this to the point where it is. And I appreciate all the nice words, but honestly, I'm just one person. It's my board that has really stepped up. That it's my members that have really stepped up, and it's all because of the leadership that we've had in the past. I mean, we're standing on shoulders of very broad, forward-thinking people. I mean, the likes of Ben Ratcliffe, if anyone can remember him, and what he stood for. He was a strong influence for me when I took this position, and he'd stop in and see me every day pretty much, and be up on the issues and tell me what he thought of what things were going forward. And then also because of people like Paul Simmons, Larry Bergen's dad, Matt, who just passed away. People like that stood on businesses that we stood on, and we're hoping that in someday would put us in a position that we could do more things or do more advocacy work such as this. And this is a big deal. I mean, as our president-elect said back when Obamacare was called, I won't add the other language, but this is really a big deal. And that's why I chose the background that we're having on my screen tonight. This is actually the setting of a long day, but the beginning of a very new day. And going forward, I'm looking forward. I mean, just look at the list of people that we got on here tonight. We got 95 people that care. They're on here not because they don't have anything to do tonight, but because they care. They're here about this issue. And Farmers Union has cared about family farms, rural America for as long as I can remember. And again, it's about the family. And I know too many people personally that have filed bankruptcy because of healthcare issues. I know too many farmers that had to quit farming because of the same thing, too many healthcare costs. And their employees, they can't hire employees that can be covered. There's just list goes on and on of reasons why we need to do this. But the biggest reason is, as David Reese, one of our board members, said, what we're doing today is all throughout our policy. Why wouldn't we step up to do something like this? And so that's why I said we're all in, and we are. I mean, this is not going to be a cheap venture. This isn't going to be an easy venture, but it's a worthwhile adventure. And if you look at the list of people with us here, Rick, I mean, I couldn't be more proud of the diverse amount of people that we have, and we will make this happen. This is not going to just be a flash in the pan. This is going to be a real big deal. And again, I appreciate everyone's help and confidence in what we're working for here. And I still can't understand why this legislature in South Dakota has ignored this position for so long. Whether it's because they don't want to, I don't believe that. I think there's other influences, but the fact of the matter is it's been too long and it's time to move forward. And Farmers Union is never going to be the one that steps back. At least that's the way I've been taught, and that's the way I talk to my people. And Farmers Union just does the right thing. And you know, this isn't going to be just about us either, right? I mean, you heard Senator Daschle talk about this is going to be an economic issue as well. This is going to be a really big deal for rural economics. This is going to be a really big deal for rural healthcare. And there's no reason that we shouldn't go forward. And I really appreciate, again, you inviting us in and to be a part of this. And we're going to do everything we can. Our members especially will step up. I can tell you that right now. There's a lot of hardworking, heart-carrying individuals that will carry petitions. It's not going to be easy with this COVID-19 either, right? I mean, but I don't think this is going to be with us forever either. I think we're going to move forward. We've lost some members. We've got some members that have passed away because of COVID, and it's not because they were not caring about it. It just happens. That's the kind of thing that happens, and I don't do this just because of the COVID thing. Believe me, this is something, like I said, our members really, really want to see happen. And we can bring this forward, Rick and Adam. I just really appreciate the work you guys have done here. And let's just get after it.
Really appreciate those comments. I wanted to also share with all of you what passage means for South Dakota. We have a year. We're one of I think the earliest state in the country that has to submit signatures. It's a year out from the actual election of 2022. So they need to be in, I believe it's November 8th of next year. Doug mentioned COVID. Ain't easy to collect signatures when people are sheltering in place. But there are social pods and family members and neighborhoods and all those things we'll talk about a little bit later with our next speaker. But before we get to that, we got what they call a fiscal note back. It's the financial impacts, and maybe we've covered this. I've been a little distracted trying to get a couple of other things done, but it was pretty phenomenal to learn from the state of South Dakota that passage would mean 42,500 people would be eligible for coverage. Those are probably family and friends and neighbors, that don't have any health insurance. And with this pandemic, I mean, yeah, you know, Adam and I like to say this is such a no-brainer. What that, you know, why wasn't this done 10 years ago when the money was free? You know, the first year of implementation, when this passes, will bring federal support of over $301,800,000 in just the first year. Almost $302 million, and we feel that that's a conservative estimate. It's going to cost the state about $20 million. But when you talk about bringing $300 million into the state each and every year, and it probably climbs, the multiplier effect of those dollars will make it, I would say, relatively painless to get for every dollar the state of South Dakota spends, $15 in federal support back. A 15-to-1 ratio. You know, you have to look back since 2010, how much money was left on the table? Billions. How many people have gotten sick? How many people have died? It's like Doug said, I mean, you know, someone needed to step up. The legislature wasn't going to do it. There didn't seem to be anybody else pushing to get it done. And I think we have a winning cause here, and it's witnessed by tonight, you know, where we have almost now 100 people that have signed up for this call. So you look at those numbers, you look at where we're positioned tonight, the fact that we could be on the streets tomorrow with our 2 petitions, and we're, you know, as President Obama likes to say, we're fired up and ready to go, and I think all of you out there are too. So we're going to be counting on you for help, because for every signature we collect with volunteers, it's one less we're going to have to pay for. And we can take the commitment that the Farmers Union has made to get this on the ballot and to help fund the campaign. Every dollar we'll save on paid collection will go towards the campaign. And so you all are critical to making this thing happen. And I really hope when the time comes, and it'll be shortly because we're talking about a training meeting next week and hitting the streets the week after Thanksgiving. But that being said, I want to, before we bring Corey on, I know there are some questions out there, and I want to give you all an opportunity. We don't have a lot of time, but I want to give you some of you an opportunity to ask a few questions, and Adam's kind of working that end of the call. So Adam, I'm going to turn it back over to you.